Well, in this week's cardiology news, we have a biomarker Lp(a) and its prognostic effects in patients with known coronary disease. Also, a randomized trial looking at the effects of statins in patients with acute pneumonia, and a meta-analysis of flu vaccine for prevention of heart attacks. So to begin with, Lp(a) is a marker that has been seen to be associated with an increased risk of developing a first coronary event, but its prognostic value in patients with known disease for a recurrent event has been less well studied. And so a colleague, Dr. O'Donoghue, here in the TIMI group, did a meta-analysis of an analysis of 3 trials here and a meta-analysis of 9 other prior trials, and interestingly found no overall prognostic marker of Lp(a). But when digging in a little further, found that in the older studies where baseline LDLs were higher, Lp(a) did confer an increased risk of cardiovascular events, whereas in the generally newer studies with lower LDL levels, it was less prognostic. And so this does suggest that as we get better and better background care, it is harder to see other risk factors breaking through that excellent care. The same pattern has been seen for HDL, one of the question marks that's come up with the HDL hypothesis. So another study looked at the effect of statins in patients with acute pneumonia. Now this was on the basis of large observational studies that have found that patients already taking statins who developed an acute infection appeared to have lower subsequent mortality. And so while this was highly touted as yet another beneficial effect of statins, it was an observational study. And so a group of investigators set out to do a very high-risk group, ventilator-dependent pneumonia patients, aimed to study 1,000 patients throughout France. And the DSMB stopped the study after just 300 patients, finding no effect. In fact, numerically higher number of deaths in those who had gotten statins amongst the 300 randomized patients. And so this is another caution to trying to implement and use observational data to guide therapy, and one where a benefit on infection has not been seen with statins overall. And finally this week we have another paper I was involved with, led by a colleague, Dr. Udell, now up at the University of Toronto, looking at flu vaccines for prevention of MI and cardiovascular death. Now, there have been several small studies, about 200 patients, each of which has shown a reduction in cardiovascular events, but with such small sample sizes, it's been unclear. There have also been observational studies, but we've just seen their problems, linking patients who had been vaccinated against flu for lower risk of cardiovascular events. And so he undertook a meta-analysis of all published, and he actually did it collaboratively and found one unpublished study to do just randomized trials. We ended up with 6,700 patients randomized to flu vaccine or not. And indeed, there was a lower risk of cardiovascular events in the vaccinated patients, the randomized group. Interestingly, this was a bigger apparent effect in higher risk patients and those with more acute coronary syndrome presentation. And so this sets up the need for a large randomized trial, but is certainly suggestive that in addition to preventing flu vaccine may help prevent a heart attack. So for this week's Cardiology News on CardioSource, I'm Chris Cannon.